A warm welcome to another session of online surgery class. Today's lecture is entitled Breast Lump Part 1. In this lecture, I will be discussing the examination of the breast and axilla, which is a very important requirement for the final medical exams. Now, before you go on with the examination of the breast, you must take a very good history with the patient, especially with the patient with breast lump. Okay, the first thing is to introduction. You have to get a consent of the patient, and to get a good history, you must have the patient's confidence. So it's very important for you to talk to the patient before you proceed on with taking history and examination. Under the presenting complaint in this patient, your patient is a patient with a lump in the breast. So you must get the details of this lump, the site of the lump, whether it's painful or painless, single or multiple, the swelling surroundings, the swelling, any other swellings in pain, any discharge from the lump, and then you have nipple problems, ulceration, inversion, or deformity of the nipple discharge, the axillary swellings, if there is any axillary swellings, whether is it associated with pain, and also ask the patient for skin changes, discoloration, ulceration, discharge. These are all very important. So the next one is to get into the history of present illness. The most important thing is to ask for the progress in the lump, size of the lump, is it increasing in size, sudden increase, is it associated with pain, and the mobility. These are all very important signs that you must ask the patient. So in summary, the breast lump assessment on history, these are the things that you look for in the assessment of the breast lump history aspect. Now, as far as the breast is concerned, there are other important things in the history that you must consider. The risk factors for the breast cancer. Okay, menstrual history, especially rate of menarche and the menopause. Family history of breast cancer. Parity of the patient. Pregnancy and breastfeeding history. History of taking of hormones, especially contraceptive pills and human hormone replacement therapy for menopausal women. And the other one is history of breast cancer in the contralateral breast. Okay, so these are all very important risk factors that you must get information from the patient. Now, the second part after you have taken a complete history is your examination. Examination consists of general inspection. You look at the general inspection, look for asymmetry of the breast, swellings, the obvious swellings that you notice, or masses, skin changes, which I mentioned, discoloration, ulceration, or discharges, and the presence of the nipple changes. Okay, usually they are the inverted nipples, ulcerated nipple, or deformed nipple. So basically you look for asymmetry, retracting and puckering, which are signs of malignancy, nipple changes, which can be used due to Paget's disease of the nipple, then changes in the skin such as pure d'orange, like as shown here, where the skin over the lump resembles that of a orange skin, so pure d'orange, and also which is also a feature of invasive ductal carcinoma. And of course, must be careful not to miss a congenital nipple inversion. Sometimes nipple inversion or inversion of the nipple may be normal, so it's important to examine to see whether it's really normal or abnormal. The other important thing is to look for inspection of the skin, changes in the skin, which include scaling of the nipple, erythema or redness of the skin over the lump, puckering, and pure d'orange, which I already mentioned. So these are the important things that you look for. Skin changes associated with breast pathology. Scaling, okay, which may be a sign of Paget's disease. Okay, you look for associated inversion of the nipple or ulceration of the nipple, and whether there is other features to suggest causes for this scaling of the nipple. And of course, you must not forget
it can be a cause of underlying carcinoma in situ or invasive carcinoma of the breast. The next change is erythema. Usually is due to infection, mastitis or breast abscess, trauma such as fat necrosis, and the important thing is it can be a underlying cause of underlying breast cancer. Puckering is due to the involvement of this tumor, usually a sign of malignancy, where the invasion of the malignant tissue into the suspensory ligaments of Cooper, and this causes draws the skin inwards, and this is called puckering. Then the peau d'orange, which is the dimpling of the skin, which resemble an orange peel. Okay, and this usually occurs due to cutaneous lymphatic edema due to lymphatic blockage, and the dimple represent tethering of the swollen skin to hair follicles and sweat glands. And peau d'orange is typically associated with inflammatory breast cancer. Okay, next you re-examine the patient with in two different postures. One is with the hands pushing onto the hips here, as can be shown here, and this helps to contract the pectoralis major, and if this repeat inspection with the hip on the patient pressing the hips to contract the pectoral muscles, and these pectoral muscles by contracting will tense and therefore reveal a mass which may not be visible otherwise. Observe it moves with the pectoralis muscle, whether the mass or whatever observation is seen. We suggest tethering to the underlying skin, invasive breast cancer. The maneuver may also accentuate puckering if a mass invading the suspensory ligaments of the breast is also tethered to the pectoralis major. So all these signs, mass, tethering or deformity, all these lesions become more obvious by contracting the pectoralis major, and one of the methods is to press the patient standing, press on the hips. The next method to make the lesions become more prominent is to lean forward, okay, and this will exacerbate the skin dimpling especially, and this is done as shown in this picture here, the arms above the head while leaning forward. Okay, so this is to complete the inspection. So once the patient puts the hands behind the head and lean forward, so that the breasts are pendulous, and if it's a fixed breast, the lump is fixed to the underlying muscles, okay, this pendulous feature will be absent. So this position exposes the entire breast and will exaggerate any asymmetry, skin dimpling or puckering. Okay, the next part of the examination is the most important. It's called the breast examination, and this is done with the patient lying the head of the bed is 45 degrees, and I ask the patient to lie down with the affected hand behind the head. And usually it's better for you to examine the asymptomatic or the normal breast first. Okay, here this is the position. This is the patient lying propped up 45 degrees, and the breast is will be exposed here. Okay, and there are three methods. Generally, there are three main methods of examining. One is the clock face method, where you can examine the lumps from 12 o'clock going right downwards, right back until 12 o'clock again. Okay, that is the view the breast as a clock face and examine each hour from outside towards the nipple. Then the other one is the spiral method, and this you begin palpation at the nipple and work outwards in a concentric circular motion. And thirdly, quadrant method, divide the breast into quadrants, especially 4 quadrants, and then you examine this breast every quadrant thoroughly. Okay, this is a quadrant method. Okay, this is the one more widely used method of examination. Now, how to go about it? You use your flat of your hand, not the tips of your fingers. Use the flat of your middle and 3 fingers to compress the breast against the chest wall. Okay, as you feel for any masses, if a mass is detected, assess the following characteristics of the mass, which is of utmost importance: the location of the mass, site of the mass, the shape, consistency, mobility, fluctuant, and the overlying skin, which I mentioned just now. So these are the features that you have to go look for in a patient with palpable breast lump. Okay, the other important part of the breast which must not be forgotten is the axillary tail. The axillary tail is a projection of breast tissue that begins in the outer quadrant of the breast and extends into the axilla. So from outer quadrant and it extends into the axilla. So it's very important to palpate for this axillary tail because the majority of breast cancers develop in the upper outer quadrant. So it's essential that this area is examined very thoroughly, as done as shown here. Okay, and this is your spiral method where you start examining the lump from outside towards the nipple in a concentric spiral method here. Okay, at the same time the axillary tail must not be forgotten. Okay, now the characteristics of the lump is a very important feature to determine whether the lump is malignant or otherwise. Okay, the location of the lump, which I already mentioned, how far is away from the nipple is very important. Which quadrant of the breast is located is also equally important. The size and shape of the lump, what are the approximate dimensions of the mass on palpation, what's the shape of the mass. Consistency is of utmost importance because consistency can be divided into smooth or soft, firm, stony hard, and rubbery. You can categorize into any of these categories. Basically, it is soft, firm, and hard. Okay, the harder, when it's stony hard, it suggests it is most likely a malignant lesion. Most malignant lesions are very hard to consistency. The overlying skin changes are important, which must be taken into consideration. Are there any changes the skin overlying the mass? Example, erythema and puckering. Mobility of the lump is important. Assess the degree of mobility of the mass. Does it move freely? Does it move with the overlying skin? Does it move with pectoralis contraction? Okay, so the movement is important to assess whether it is stuck to the underlying muscles or whether it is involving and adherent to the overlying skin. So this overlying skin and underlying muscles are very important to assess whether the lump is attached to them. And finally, you have the fluctuants. Hold the mass by its side and then apply pressure to the center of the mass with another finger. If the mass is fluid filled, example cyst, then you should feel the sides bulges outwards. This is your fluctuancy test. If it is fluctuant, most likely it is a fluid filled cyst, and cysts are usually benign lesions. Okay, the other important thing is your nipple areola complex, as shown in this patient here. Okay, here you have got your nipple and the areola surrounding the areas, hyperpigmented area surrounding the nipple, and also these glands in the nipple areola. This is known as the Montgomery glands. Okay, this is another view to show you the breast consists of lobules, multiple nodules, and these lobules are drained by ducts known as lactiferous ducts. So the milk that is produced in the lobules are drained through these lactiferous ducts into the nipple to be discharged. Okay, now how to examine a patient with nipple discharge? Okay, use the flat of your fingers, of your middle three fingers, to compress the areola towards the nipple as you inspect for any discharge. Okay, as shown here. Try to compress and see whether there's any discharge. Okay, if there's a history of nipple discharge, but nothing is not obviously seen, it is not visible, it's better to ask the patient to express the discharge from the nipple if she is comfortable to do so, and assess characteristics of the discharge. If she is unable, then you can try to use your fingers to express to see whether there's any nipple discharge. Now the important thing is nipple discharge is once there is discharge, then you must check for the color, whether it's blood stain, green or yellow. Consistency is thick, watery, and the amount, volume of discharge. These are all important features of various diseases. Okay, the nipple discharge itself can be milky. Milky discharge is due to a lactating breast. It is normal during pregnancy and when breastfeeding, and this usually occurs bilaterally. Yeah, it can be purulent, where the pus is discharged. This is thick yellow, green or brown discharge with an offensive smell. And the possible causes include mastitis and central breast abscess. Okay, so purulent discharge is usually a sign of infection. And watery and bloody discharge, several possible causes. However, ductal carcinoma in situ is the most important diagnosis to consider. So, cancer. Okay, so from the nipple discharge, you may be able to tell whether it is normal, lactating, infection, or cancer. Okay, next, after examining the breast, the other important thing in breast lumps is to examine the axilla for lymph nodes. Okay, these are the lymph nodes that these are the various methods. Ensure the patient is positioned. The best position will be the patient sitting on the edge of the bed, and you stand in front of the patient. Okay, ask if the patient has any pain in either shoulder before moving the arm. Begin by inspecting each axilla for scars, masses or skin changes. And when to examine the patient, what you do is you hold the patient's right forearm in your right hand and instruct them to relax it completely, allowing you to support the weight. This allows the axillary muscles to relax, so make the axilla more accessible to examination. Palpation should be then performed with the left hand. The reverse is applied when examining the left axilla. Okay, so these are the various things that you do. If the patient's right axilla you want to examine, you support the her arm with your left hand, and then with your right hand, and then use your left hand to palpate the axilla. Hold the patient's right arm in your right hand. Palpate the patient's right axilla with your left hand. So this is a very important picture that you must remember. Examination technique of examining the breast, and you must be able to examine the various groups of lymph nodes in the breast. Okay, the anterior group of lymph nodes or the pectoral lymph nodes, central or medial lymph nodes, subscapular posterior group of lymph nodes, humeral or lateral lymph nodes, and apical lymph nodes. So the pectoral lymph nodes or anterior group is examined using your palm towards you, the palm facing back towards you, and you feel the inner surface of the pectoralis major. The central group of lymph nodes can be examined by the palm facing medially against the chest wall. The subscapular or the posterior group of lymph nodes, palm facing away from you. That means you are feeling for the subscapular area there. Okay, there is posterior. Okay, so the posterior group of lymph nodes. And the humeral is the lateral group of lymph nodes which are present in the inner arm, inner arm within the axilla. That's a lateral part here. Okay, here. And the apical groups, you reach upwards in the apex of the axilla. Okay, the description here tells you how do you go about examining the various groups, the 5 groups of lymph nodes in the axilla. And once this is completed, if you notice a lump, then you must describe the size, consistency, and fixation. These are very important. And the same, once you have completed, then you have to do the same for the opposite or the contralateral axilla. Once you have examined the axillary lymph nodes, then you have to go and examine the other lymph nodes, the infraclavicular lymph nodes, supraclavicular nodes, and the cervical lymph nodes, especially the lower cervical lymph nodes, which I have described to you in the examination of the neck and thyroid. Okay, the other lymph nodes are all you have to look for, and these include your cervical lymph nodes, supraclavicular, infraclavicular, and parasternal lymph nodes. Parasternal lymph nodes are usually not palpable.
But now we come, and finally, after examining the patient and taking a good history, now you have to provide a summary. Okay, this is a sample summary. Madam K, a 64-year-old female, complained of a lump in her left breast for 1 month. On general inspection, she appeared comfortable and well. Closer inspection of the chest did not reveal any scars or breast abnormalities. Palpation of the breast revealed a single lump in the left upper quadrant of her left breast. Upper outer quadrant, it measured 2 by 3 centimeters, firm and mobile, and there were no signs of regional lymphadenopathy. These findings are consistent with the fibroadenoma, but considering the age of the patient, carcinoma of the breast should be excluded. In order to proceed on, I would like to perform the following investigations to confirm the diagnosis. Mammogram, typically used when patients were 35 years of old, and our patient is 65, so the mammogram is very essential for this patient. Next is an ultrasound scan. Typically, it's more useful in female patients, but it is very important to be done in the elderly, in this patient, to determine the nature of the lump, whether it's a cystic or a solid lump. And finally, I will recommend a core biopsy of the breast lump under ultrasound guidance for further histological assessment of the lump to determine whether it is malignant or otherwise. Okay. Finally, after the history and examination, you should be able to derive at a possible clinical diagnosis. You must be able to suggest whether it is a benign or malignant lesion of the breast that you are dealing with. I'll show you a short video on the OSCE Guide of Breast Examination, which is a very important exam topic.
Hi, I'm Simon, one of the junior doctors. Can I just check your name and age, please?
Yeah, it's Leola and I'm 23.
Nice to meet Leola. So today I need to perform a breast examination. Have you ever had one of these before?
No.
Okay. And which breast is of concern to you?
I felt a lump in my left breast.
Okay. So what this examination will involve is me having a look and a feel of the breast tissue. Are you happy for me to go ahead?
Yeah, that's fine.
All right. What I'll do is I'll let you get undressed, so taking your top things off, including your bra, and then popping this gown on to cover up. In the meantime, I'll fetch one of the nursing staff to act as a chaperone throughout.
Okay.
All right. Okay, Leola, if you could just put your hands on your hips for me, and now just press down on the hips. And now if you could put your hands behind your head and push your elbows back. And now just lean forward for me. Okay, thank you. Okay, Leola, if you could lie down for me now, I'm going to examine the breast. And if you could just put your right hand behind your head for me. Thank you. I just want to make sure that there's no discharge from the nipple. If you could just squeeze your right nipple between your thumb and index finger. Okay, thank you. If you could just switch the hand behind your head. Thank you. Now could you just tense your chest muscles, Leola? Thank you. What I need to do now is have a feel of the glands in your armpit, okay? So if I could start on the right, I'll just take all the weight of your arm, so just completely relax it, okay? Okay, Leola, I'll do the same on your left side now. So again, just relax, let me take all the weight. I'm just going to have a feel of the glands in your neck now, alright? That completes the examination. Thank you very much, Leola. I'll just leave you to get dressed now.
Thanks.
Today I performed a breast examination on Leola, a 23-year-old lady. On inspection of the right breast, there was evidence of nipple ulceration and there was erythema in the lower outer right quadrant. On inspection of the left breast, there was evidence of nipple retraction and also peau d'orange in the left lower outer quadrant. On palpation of the left breast, there was a firm, craggy 3 by 3 centimetre mass at approximately 2 o'clock. It was located 4 centimetres from the nipple and it appeared to be tethered to the underlying tissues. There were no other lumps on palpation and there was no lymph node involvement. For completion, I would consider further examinations to detect the presence of disseminated malignancy. I would arrange ultrasound scan and also core biopsy or fine needle aspiration of the mass.
Okay, thank you for joining this short session on breast examination. I hope it was useful to you, and as I always tell you, practice makes perfect. The more you examine, the better you become in breast examination. Thank you.